How do I know I've got a true leg length problem? So we see a lot of patients that come here to the clinic and they're saying, oh, someone saw me and they said I've got one leg centimetre, an inch, whatever, longer than the other. But invariably, they've done it on a bench, so the patient's just lying there, they pull the legs and they press on this bony bit here, which is just on the front of your pelvis. And then look at the bony bit on your ankle and say, oh, it's about this long. That's really, really inaccurate. First and foremost, that is not where your leg is. And depending on whether these two bones are rotated at all, that can give you an artificially false reading. So it's very, very inaccurate. The best way to measure the leg length, one of the things we do here at the clinic when it's appropriate and clinically relevant, is standing with the heels together, which minimizes the foot involvement because sometimes the arches can play into things. So your arches in the feet are like little bridges. And if one drops more than the other, that can affect the leg length and mean that you get an inaccurate reading. So standing with the heels together when you get the images taken can really minimize and work against that being a problem, which is great. And then when you take the x-rays, you're looking at the top of this hip here, which is the top of your actual leg bone, or the femur, the one on the top, as opposed to measuring something that's not your leg. So that's inaccurate. So this is by far the most accurate way of measuring and knowing for sure if you do have a leg length, and then understanding, is that difference? If it's a millimetre or two, it's not significant. Or is it a centimetre, half, and actually something that making some changes with regards to insoles in your shoes can actually impact? And how does that leg length, if it is significant, play into your back pain perhaps? To review, don't measure your legs lying down on a bench. Get them done properly if it's clinically relevant, standing up, and get an x-ray and shoot straight at those hip levels and measure it accurately, and then feed that information into your back pain, glute pain, hip pain, whatever it may well be, to formulate a more accurate solution to your problem.